Well, welcome back to another mental health moment. We hope that you've been watching these videos and been just amazingly impacted by them and impacted by all these resources we have here in El Paso County and in Colorado Springs. And today, I have two phenomenal people that have been working in the efforts of youth suicide prevention and have been leading the charge and leading a phenomenal committee here in El Paso County. And I want you to meet two of my friends, Kelsey and Meghan. They're going to introduce to you what they've been doing and how they've been handling things even during this COVID time. But before we get to that, I call it BC. But before COVID, BC, like I want to hear from you all, and you can introduce yourselves individually, but like what's been this unique thing that you have taken on during COVID? Maybe you started a new routine or a new rhythm. I've asked every one of our guests this, and I've found some really interesting things that they've done. They've done catapults. They started building homemade catapults, which is really interesting. I don't know if either one of you are into that, but we'll see here shortly. Kelsey, we'll start with you first and go to Meghan. But Kelsey, tell us a little bit about you.
All right. Hello, I'm Kelsey Leva. I'm the Youth Health and Development Planner for El Paso County Public Health, and I co-lead the Youth Suicide Prevention Workgroup with Meghan, among other things, many duties. And something fun that I have kind of embraced during COVID-19 is having breakfast with my husband and taking my dog for a walk like every single morning. And it's amazing. Like not having that travel time to the office has given me that much freedom, and I am loving it. I actually am going to miss it a lot, I think, when we go back to normal.
Don't go back. Don't go. There's some people like, don't go back, because those are valuable moments. That's awesome.
Great.
He's making breakfast, or you're making good breakfast.
No, he makes the breakfast, and it's awesome. It's even better, you know?
Now we know the whole story.
Yep.
Now we know the whole story. Meghan, are you getting breakfast?
No, I'm still on my own. So I feel like I need to crash Kelsey's breakfast party somehow in a very socially and physically distant, responsible sort of way, of course.
Yes. With less than 10 people. So I think we'll be okay.
Yes.
Meghan, tell us about you.
Sure. So I'm Meghan Haynes. I'm the Teen Suicide Prevention Planner for El Paso County Public Health. Like Kelsey mentioned, I co-lead the Youth Suicide Prevention Workgroup with her, among a bunch of other duties that we're juggling at the agency. And I think one of the greatest things to come out of this time for us right now as a family is we've been taking more walks together as a family. We have a park in our neighborhood, and I recognize we can't use the playground equipment, which really bums my kid out. But he's gone super fond of the basketball hoops there at the park. You guys, he's 2.5 years old. He's a little dude. Like he can't play basketball, but he insists on taking a walk, going to the basketball hoops, and we take his little play basketball, and he plays like we play basketball. And so he tries to shoot hoops, and we try too, and it's just hilarious, but he's so insistent on it. So
I like that you said we try. Like he's like an aspiring athlete, and you're like, he's not gonna, like he's just not making it. Like he's just like
yeah, I mean it is what it is, and he'll insist on, Mama, Dada, you shoot hoops, and it's like, okay, well we'll try, but
we just got the ball for special effects, kid. We did not get it to shoot. Like we were not looking to play basketball.
Yeah, it's like the ball that comes with his little Tykes, kid appropriate basketball hoop. So it's been hilarious trying to do that on a full-size one at a city park. It's great.
I love it. Good workout for you, probably. Like,
oh my gosh, yes.
You should just carry the hoop with you, the little Tyke hoop, to the park, and just put it there and be like, this is it, kid. Like this is how you dunk. That's awesome. I've actually taken up a retail therapy. So like I can tell you anything about J's. I've been buying shoes like nonstop, as well as becoming a landscaper between the middle of all this. So like we've built a new patio in our front, and like it's become this oasis. Like I literally know where I'm going to be the rest of the summer. Like I'm going to be in this oasis because of COVID, and COVID offered this to me, and now I've got this cool oasis. So we've done a lot of those things, and I took up like walking for a little while, but I got bored, and so I was like, I got a car, so I can drive, so I won't walk anymore. I just stopped walking. My dog's happy about that. They're like, he's like getting old, and he can't walk. He was like, we were barely going down. We were going downhill, no joke, downhill. And he's like, I was like, God, you're getting old, buddy. Like, it's that season. So tell us about what you guys do. So what is this? You said this Youth Suicide Prevention Workgroup that we're a part of. Like, tell us a little bit about that.
Megan, do you want to do kind of the history, and then I can talk about the kind of action planning piece? And
yeah, so the Youth Suicide Prevention Workgroup has been in existence since July of 2016, if you can believe that.
Wow, that's long.
We're coming up on 4 years of convening community partners around youth suicide prevention, which is amazing. And initially, when we started bringing folks together back in 2016, we had identified a real need for better coordinating our efforts. We thought we had some real missed opportunities between all the folks doing work around suicide prevention in the community to develop a greater circle of care around youth who were at risk for suicide. And when we first started meeting, we thought, well, maybe we're just seeing breakdowns in communication. Like, let's focus on bringing our partners together, understanding the issue, how we might better communicate to better serve our young people in our community. And as time marched on and we were poking at, what are some of the needs in our community? What's going well? What can we translate? It has really grown significantly since then to include a large number of efforts. We've grown the subgroup or the work group to include 7 different subgroups.
Wow.
And are just engaging partners from across the county, across multiple sectors. And it's so much more than just that simple communication and circle of care piece, which is really, really important. But we've been so blessed to see the different areas that we can have impact. And so with that, we moved into action planning, and Kelsey can speak a little bit more to what that's looked like for us the past couple of years.
Awesome.
Yeah, so I mean, we were really fortunate to have just this crazy investment and interest from the community that grew beyond our wildest dreams with starting this project. And and people are so passionate about this issue in our community and so invested that they were really ready to say, like, okay, we're done talking about it, let's do something. And so I got to come in at that really awesome moment and help us transition from just talking and figuring out the gaps and things to truly action planning and making a plan as a community for what are we going to do about this, and who's going to do what, and who's going to bring this piece, and I'll bring that piece, and this is when we're going to get it done. And really we've accomplished amazing things as a group with this collaborative. And the role that Meghan and I play in this is really just as the backbone agency is what we call it, and it's supporting and kind of creating the space for this community work to happen. Our job is in some ways to kind of get out of the way and let the community know what they need and where they want to go and how they want to do it, so that it's truly a community-led solution for a really complicated problem,
That's amazing. And you guys have done a phenomenal job with that. As being a participant in that group and being somebody within that group, like, you guys have done a phenomenal job. So thank you for convening, and thank you for leading and facilitating that. That has been phenomenal. One of the things that I like that you guys are saying is there's this collaborative effort. There's this phrase that's been going around during COVID that says, we're all in this together. But I think really the youth suicide prevention, this group has really captivated that idea, has captured that idea in purpose and in action. And so you've got, like, we're really all in this together, meaning, like, we're working towards one effort. We're working towards an effort of, hey, we're going to do this thing. We're going to actually apply what we've learned in application in maybe our various areas. So that's phenomenal. So as you've seen this effort now, because things have changed, I mean, we're all in different locations right now. We could have been together. We could have at some point, but now we're not. And so you're all, we're abiding by the protocols and procedures that have been offered to our community. Like, what have you seen with COVID that's gone on that's been hopeful for you guys, even in the midst of what's gone on with youth suicide prevention and all that kind of stuff?
I mean, I'll jump in a little bit. There have been a couple of really cool ways that our community has stepped forward to support each other and kind of address some of the risk factors that we see kind of enhanced during COVID-19, things like isolation and even just having food and resources like Cause I Love You and Pike Speak United Way. Amazing partnership there, making sure that people have the food that they need to nourish themselves and that they don't have to be at unnecessary risk going out and getting that food. Like, that's an awesome example. We have seen great things in our community around connecting in creative ways, and I love that. So many cool things that have come out of that. We have a lot of really intentional youth-led efforts right now that I'm so excited about. Young people talking to each other and supporting each other through this time, and supporting each other in coping skills, in addressing their grief over the loss of so many important events and moments in their lives, and maybe even loss of people, and just heartache at home in the world. And so I think it's just amazing to see adults in our community empowering young people to have those conversations amongst each other, and to be leaders, and to inspire us as adults too in the midst of all of this. I think those are some of my favorite things that I've seen.
That's awesome. So awesome to hear. Meghan, on your end, what are you seeing in regards to this COVID and the things that you're navigating now since all the changes?
I think I've been truly amazed at how mindful all of our community partners have been about taking care of all the people that they regularly work with, whether that be young people, the other people that they work with as colleagues, how seemingly seamlessly some of this has been able to happen virtually. We recognize it's not ideal, right? Like, we have this real need for that real human connection. I'd be lying if I said that I didn't miss all of my social interactions. So doing things virtually is so difficult, but I have been amazed at what we've been able to arrange as a community in terms of all the things that Kelsey mentioned, how our school partners are supporting young people and their needs, whether that be, meals throughout the school day, whether that be mental health needs, just some of the creative programming and opportunities for people to connect that our partners like at Pikes Peak Suicide Prevention and Inside Out Youth Services have offered. And it just seems like, for what's really an unprecedented situation for most of us, we've been able to pivot so well. And I'm very hopeful that people are still able to access what they need, even though I recognize it's not ideal right now.
Right.
But we're all doing the best we can. And I've just been so encouraged by the way the community has come together to support people. And I can only imagine how much better that would be without that bit of community spirit that we have around it. And so it's just been wonderful to see.
That's awesome. I think in large part to this particular group, the Youth Suicide Prevention Group, because we had that relational equity and that investment prior to going virtual, that pivot was more impactful and more strategic versus, hey, what are you doing? And everyone just going around. I mean, I've had more calls with our partners inside that group that we've been able to do stuff in partnership and together. I mean, I'm creating right now, Cass Walton over at Pikes Peak Suicide Prevention. We're doing videos together and interviewing minorities with mental health to talk about what's going on in there during this mental health awareness month. And so, but because of you guys facilitating that group, like, I would have never met her otherwise. But because of that group, you guys facilitated that, and we made those connections. As you guys are preparing and thinking about forward thinking, what are some things that you guys would want to make sure people know going into this summer and going into this time that would be helpful for them to be aware of from your lens and from your perspective?
I mean, that's a really great question. I think the thing that is hard is that there's still a lot of unknown, right, about how this is going to continue on in the summer months. But I find a lot of hope in knowing that all of those community partners that are already doing this great work are just as equally dedicated to making sure that we get through the summer with as many supports as possible for young people and their families. And it's just, we're at a point now, I think, where we're really trying to collate that information and bring it all together to make sure that, we are aware of what's out there and what supports are there, and relying on this network that we've created to be able to leverage those things and make sure that folks know what's available. And the work doesn't end, just because we head into summer. It just looks slightly different. And that's how it is in a traditional school year too, right? Like, the work doesn't end over the summer. It just takes on a different face. And so And I know we have some specific things coming down the pike in terms of youth-driven messaging and things that will take us into the summer that will hopefully help with that. And I don't know, Kelsey, if you can speak to that a little bit more.
Yeah, I'd be happy to. So there's an awesome effort collaboratively in our community. And as you mentioned, Cass earlier, Pike Speak Suicide Prevention and CHP and others in our community have all kind of come together to empower young people to create their own coping methods campaign on social media. That's going to be really awesome. And I'm so excited about that. So that will launch soon. And I think we should all be really pushing that from our angles as much as we can, and supporting the young people that have helped design that and created that. And then I think, just all the things that we normally do that are good for our brains, I think we just need to be intentional about continuing to do those things for ourselves and encouraging those around us to do them, and check in with our people, and don't hesitate to do that, to keep checking in and connecting in whatever creative way that might be. I also think there's a lot of opportunities to be part of community right now in creative ways. You can volunteer, and I'll just throw it out there. The public health website is a great resource. We've been really focused on putting out a lot of different things, more than you'd think. It's not just like your typical medical information. It's also mental health information, and it's about, how to talk to your kids about COVID-19, and, the why behind things, trying to empower people with understanding and research. And then, we also have some great resources on how you can get involved and volunteer in our community, because that is so good for our brains and our souls. That's awesome. So I think those are all things we can be doing over the summer to just, stay connected and stay healthy.
That's awesome. As you mentioned those, just so everyone knows, we're going to put all those links below, whether it's on Facebook, on YouTube. You can actually click on those things and get those resources along the way. Meghan and Kelsey, as we kind of come to a close here in a minute, what do you want to make sure people are aware of that you guys have as resource? Like, why support this Youth Suicide Prevention Workgroup, and why support what the county is doing in the middle of this? Like kind of give us that pitch that's like, hey, if you want to join, what if they want to join? Like, what if they're interested in being a part of this and being collaborative with us? There may be somebody watching for the first time that's never heard of this group, but is very passionate about this. So ways to join. And then just again, even if you want to let people know, like, how do I get in contact with all of you?
So, we welcome anyone who has a passion for this topic and has a little bit of time and energy they want to devote to it. We'd love to have them at the table. And that we have all kinds of different partners from our community, and you don't have to represent an organization. You can come just as someone with lived experience who wants to be part of this discussion. So everybody's welcome, and they would just connect with Meghan or myself. And we have a great page on our website. We'll make sure we give David the link for that for everyone. And that really describes the Youth Suicide Prevention Workgroup and kind of the different subgroups and different actions that we're taking. So if you can kind of take a look at those and see if you see yourself participating in some of that work, we'd love to have you. And then just, public health is more than just COVID-19. We have a big role in that, but we have a lot of resources and information for people about how to stay healthy and just ways that they can take care of their mental health too. So just take a look at that website and look around. It's a great resource.
That's awesome. Well, I will take those things, and we'll make sure all the links are below, around us, wherever they're at in space on this page. But we will make sure that they're all available, as well as when that campaign comes out for those students that are doing that, we will make sure that that's promoted and make sure that information gets out to our viewers and to our constituents during that time. You guys are phenomenal people. You said this earlier. Someone said that you're the backbone, and you really are. You guys are that structure that is holding this collaboration together. And we're so grateful for that in our community, because we have seen the impact. We have seen individual lives transformed, changed, and saved because of what you guys do. And so thank you. And we so appreciate it. Thank you for your time today. Thank you for sharing with what's going on in your guys' world. I hope that you have more slam dunks coming, Meghan, and more scrambled eggs, Kelsey. If you like scrambled eggs, I'm an over easy guy. But here's what I will say. Thank you for listening to our mental health moment today. If you need any of this information, you can visit educationforalifetime.com Follow us on our Facebook page. If you're on YouTube, or if you're on Facebook, follow us on YouTube. Go ahead and get in and plugged into all those socials with us. We so appreciate you all. Stay well. Know that you're loved. Know that you're valued, and know that you're needed.